sympathomimetics or adrenergic agonists are medications that are used in the critical care setting. And those include epinephrine and norepinephrine. So our bodies make these hormones, but we can also administer them to the patient in the IV. And indications, or what these medications do in the body, they mimic that sympathetic response. They agonize the adrenergic response. So they help us stimulate that adrenaline response. Therefore, the heart rate will go up, the blood pressure will go up, the blood flow to the muscles will increase, as well as the pupils might dilate so that we can focus, and also the bronchioles will dilate so that we can take in more oxygen to facilitate that fight or flight response that we're trying to elicit. Now, sympathomimetics, epinephrine and norepinephrine are contraindicated if there's hypertension, because they're going to drive the blood pressure up more. If there's a myocardial infarction, because we don't want to increase the workload on the heart. If the patient is pregnant or breastfeeding, because it might have an effect on the uterus and shift the blood away and therefore harm the fetus. Also in atrial fibrillation, when the heart is already quivering and not functioning right, then we could cause some more problems there, because atrial fibrillation many times will be uncontrolled, meaning the rate is over 100. And then we also don't want to give these sympathomimetics if the patient is fluid volume depleted. So if they're dehydrated and we are trying to vasoconstrict to increase their blood pressure, it's not really going to work and maybe have a counter effect or a bad effect on the patient, because there's not enough volume to make those blood vessels squeeze and the blood pressure to go up.